Ladies and gentlemen, it is with great pleasure that I introduce our esteemed speaker for today's discussion, Dato Lim Siow Jin, founder of DXN. Dato Lim graduated from the famed Indian Institution of Technology. Dato Lim has a deep interest in mushroom and their relationship with human health. After more than 20 years of careful research and scientific analysis, Dato Lim discovered specific benefits of Ganoderma or Lingzhi and its corresponding effects on human health. Realizing Lingzhi's important and health benefits, Dato Lim began sharing his knowledge about these miraculous herbs among his friends and colleagues, who mirrored his passion for good health. Dato Lim did not stop there. He felt that he should form a company that would help more people get acquainted with the benefits of these miraculous herbs. In 1993, Dato Lim's dreams came true when he established DXN in Kedah, Malaysia. Let's give Dato Lim a warm welcome and a loud round of applause.
Good morning. So, Professor Dr. Zabidi Hussein, as Vice Chancellor, University of Sarujaya, Professor Dr. Mudayarasan Kupusami, as a Deputy Vice Chancellor at University of Sarujaya, Associate Professor Dr. Ibrahim Osman Haska, Dean of Faculty of Traditional and Complementary Medicines, this Dato Colin Chai, Special Consultant to DXN Holding Bahat, Dr. Siwa Kumaran Karupia, Crown Ambassador of DXN Holding, then Dr. Khan Muhammad Yamin, Lecturer of Faculty of Traditional and Complementary Medicines, Dr. Resmi B. Devan, Lecturer of Faculty of Traditional and Complementary Medicines, Professors and Lecturers, distinguished guests, my dear DXN member and friend. Once again, good morning. So before I talk about Ganoderma, okay, allow me to spend a few minutes about this integrated medical approach. Okay, now we are combining the Western medicines and also the traditional medicines. Basically, this medicines like engineering, they are various faculty, okay, and each discipline have their own way of training, okay. So for me, I classify into two main training, okay. For example, Western medicine is under microtherapy. I mean, we are using instrument to check into details, into the cells, into the compositions of your blood, go into the minute study of microtherapy. But for traditional, for thousands of years, they don't have instrument. They only use the five senses to check everything. Then we call macro. Anything you can see your eye, you can hear, you can feel, you're listening, this one is macro. Okay, so these are the two main categories. Is macrotherapy important for modern medicine? Very, very important. Let me give you a few examples. Okay, many years ago, one of our family members, the kids, having fever, so sent to the hospital. Okay, then the fever became higher and higher. Then after that, they become panic. After about nearly a week, the fever keep on increasing. They come to see me. So I go to the university, I go to the hospital to look at the kids. Now, when you facing fever, basically there are two types of fever. One is external, one is internal. Okay, external fever, they always feel chill. This is a characteristic. Then you can see with the eye, you can see chill. The internal one, no chill. And the tongue is very red, this thing. So when I look at the kids, the tongue is very red and the lips very, this is internal fever. Okay, so how the doctor treat the child when the fever very high, they apply water, you know. That's wrong treatment, you know. That's wrong treatment. When internal fever, you apply water, okay, you block the pulse, okay, then after that the fever come back even higher. Then they insert the medicines to the anal to induce sweating. Induce sweating is a wrong treatment. Because internal fever, you have dehydration already, you know. You should not induce sweating. So I have words with the doctor there. I said, I want to treat this child. I told them, better let me treat the child. And they said, hey, this hospital, I'm not sure whether they allow you to do that or not. So luckily, the dean of the hospital, they know me. So I told him, you are doing the wrong treatment. You know. I want to treat the child, okay or not. If they say not okay, I say better you discharge the child, go back to the house. I will treat it myself. No, wrong treatment. The child may cause, wrong treatment, it cause fatality, you know. So what I do, I bring my mother, okay, so the fever very high, we need to bring out the fever. So my brother using this sirih, this sirih, bitter leaf, bound with this vinegar, talk about it. Now when you're using vinegar and stipate, you brown it very different from water. First, you do not block the pulse. Secondly, internal one, we can use gypsum or pearl powder. Okay, but we use pearl powder DXN selling pearl powder. Within 1 day, the fever come down and discharge. So this one example Another example the macrotherapy. Why is important? Just a few days ago, some member come to see me. He had one Indonesian friend. Okay, he come and he got to practice yoga. Yoga is a good thing now. After practicing yoga, suddenly see chills and sweating, sweating, and then after that, phobia develop, fear, phobia develop, then become very emotional, then they become very wrong, then they go to the hospital, even go to the ICU. When you go to ICU, then the situation become worse and worse now. After I check all the symptoms now, I told them this is a simple stomach problem. Because all this is a telltale sign, It's a stomach problem. Okay, so luckily the DXN, so we have some this herbal pops. I say you try to give 2 days time, everything come back to normal and go back to Indonesia. So I'm trying to tell you, okay, now we need to integrate both systems. One is the microtherapy. One is the macrotherapy. Ganotherapy is under this macrotherapy. Okay, so this sounds just a simple introduction to you. Now, over 30 years, we are using Ganotherapy. So I also established a system of therapy using Ganotherapy. We call it Ganotherapy. Okay, what to observe? Only 2 things to observe. Okay, one is toxin. Okay, so Ganotherapy only deal with 2 things. Detoxifications and balance back the body function. Okay, this thing. Toxin can be observed or not? Easily observable. Okay, now 30 years ago, I made a proposal. All the health problem, there's only 2 main problems for health problem. One is caused by toxin. What you doesn't want still inside your body is required toxin. Okay, all the acid, all the what they call the contamination from the water, from the air, is toxin. Even water, if you intake too much water, it doesn't become toxin. Okay, something too much also no good, 2 liters also no good. Okay, now toxin can be easily observable. You know why? Because when the body discharges toxin, toxin is something materialistic. It's observable. So discharge, okay, upper body through vomiting, vomiting, okay, skin, sweating, through urine, through stool, is observable. Okay. Now, I give you a few examples. There is one asthma patient. Okay, asthma patient is very sick. Okay, in a week's time, you get an MC for 2 or 3 days. Every day, every week is a signal. And he is a cigarette seller. And he told me, actually the company is very high of him. The company is good. The company never make any noise. He having MC every week, Okay, the boss very good to him, but he feel bad, He say, now I'm 30 over years, like this, I think my life is very much affected, Then they started taking Ganotherapy. After taking Ganotherapy, they started to vomit, Vomit, and a lot of frame come out, And he is very skinny. Okay, vomit, they said, 2 bowl of frames. There's a lot of frame, There's a lungs of frame. Then they're very sick. After detox, our energy level coming down, they feel sick, Okay, they telephone me. I said, continue. This is a good sign, Please detox, continue. After vomit for about 3 to 4 days time, then after that everything become okay, Okay, then after that no more MC, everything become okay. When he is about 5 years old, he is sick, fever, When he is fever, okay, in the village, he doesn't know anything, Fever, they soak him in the tongue with cold water. After that, you see when you have fever, the cold water, that everything will push into the lung. Then they develop this asthma. Then the older he become, the more serious, Okay, so the only way to treat this asthma is to reverse, to push up the toxin that we push to the listing. Then after that, the whole thing become normal, And also he become very active in DXN, become our diamond. This is one example, Okay, now vomiting, Okay, when people take medicine, they vomit, they feel very scary. To us, it's something that is very good. Okay, I give you one example. During the COVID time, okay, we give Ganotherapy, we give this thing. So one of even the TCM doctors, they telephoned me. He said after giving this thing, the patient started to vomit. It became very scary, Okay, I say you are the TCM doctors, Okay, the traditional. Okay, so when you give medicine to a patient and he started to vomit, you must immediately know that this is detoxification. Okay, remove toxin. Okay, you observe this thing. Okay, he say what to do now. See, let him continue to vomit. Don't stop the vomit. Okay, I give you one more example of this thing. In the early day of DXN, I remember this until today. In the very early day of DXN, okay, one young man is suffering from this diabetes, very very strong diabetes at 20 something. Then at the end, he go to all the doctors, the hospital, everything. The diabetes become very stubborn, They will come down. Then at the age of 20 something, I started bedridden. Cannot come up on the bed, cannot work, everything. Then take Ganotherapy. After taking Ganotherapy, I started vomit, Not only vomit, the blood in the vomit. So everybody becomes scary, My goodness, taking Ganotherapy and vomit blood. That's scary, Oh, then when I go to the office, I saw my staff walking here and there, fainting, I asked him what happened. He said, someone eating our Ganotherapy and started to vomit blood, Very scary, So I telephoned them. I said, what is the color of the blood? Now, when people vomit blood, if the color is fresh, okay, that means from the lung. From the lung. If the color is dark, that means from the stomach. Why? Because the blood, when it mixes with our acid, it becomes blood color. Okay, but if it's mixed, partly fresh, partly dark, it's due to internal injury. Internal injury, is a thing. So they told me that it's partly dark, partly fresh. I said this is a case of internal injury, nothing to do with diabetes. Check the history. True enough, a few years ago, the young man having accident. So accident, he hit on the steering. Nothing wrong, but after he becomes sick. Then after he developed this diabetes. So then I think there's internal injury. So when taking Ganotherapy, we started to remove the blood stasis. Okay, the clotting blood. Okay, then we move it up all the blood. So they say what to do. I say continue. Vomit for a few days. Okay. Then after that, everything became okay. In about 9 days time, he started to go back to work. So about 3 weeks time, he come to see me. He's still very skinny, and he thanks me that Ganotherapy save him, this thing. So what I'm trying to to propose to you is that, okay, we are from a school, okay, the symptom is observable. When the symptom observable is very easy to study, to study. Now, I tell you another problem, another example. It's better to use example. Example talks better than many things, you know. Okay, sweating. I give you two examples, very funny thing. I go to Penang, okay, one day, you know, okay, then one of this consumer told me, hey, Dr. Lim, do you put any color in your granuloma? I said, no, I don't put any color, no. Okay, I said, what happened? He said, I am playing badminton, so we have a white t-shirt team and we have a yellow t-shirt team. I'm for the white t-shirt, you know. Some water for me, yeah. Oh, good. To balance my body. It's a macrotherapy. Yeah. So he from a white t-shirt and yellow t-shirt. I'm from a white t-shirt. But after taking a retinol, I started to sweat, and the sweat is yellow in color. Okay, my t-shirt turned yellow. I need to join the yellow t-shirt here. I say, what color are you put into your granuloma? I tell him, no, I don't put any color into the granuloma. And he said, how is the yellow in the sweat coming from? I tell him, this detox now. Tell me, what's your profession? He's a goldsmith. So he's in charge of the gold cleansing section and all. He use acid to clean the gold, and he never wear the mask. Because we never wear the mask, so a lot of film will go to the body. I tell him this detox now. Okay, this detox now. So he keep on taking the thing, sweating until the sweat become normal. He told me, you know, after 1 month, but he made me again. You see, before that, he always feel tired in the daytime. Very tired now. After this detox, then he feel much better. Okay, much better, this sort of thing. I'll tell you another funny story about sweating. Okay, one day I received a call. Okay, one fellow, he said he's selling roti canai. Hey, roti canai talking, okay. I said, after taking a granuloma, I said, no, the sweat is so smelly that the customer all run away. He said, so smelly, even my neighbor can smell it. I said, I said, I cost now 3 days now. You see, when I take the granuloma, okay, it doesn't make me smell good in my life, this thing, but it smells so smelly, you know. I say, this detox now. I said, what have you done? He did for 16 years, he never sweats. No sweating for 16 years now. When the people do not sweat for 16 years, something must be blocking the pores. I said, 16 years ago, what have you done? He is this farmer. So he sprayed the insecticide, stay the Racun Swanga. So by right he should wear all the cloth, everything to protect himself. But because the day is very warm, very hot, you know, so he very thorough, you know. Only wear with socks, not even wearing anything like spray, then all the toxin come. He become very sick for many days. After that he never sweat. Okay, then he started to sell roti canai. Even in a hot stop, never sweats. Never sweats. After taking granuloma, I started to sweat like mad, and the sweating is very smelly. I told him, congratulations. Yeah, good thing, he talks to me. Now continue, then after that become okay. There's another example. Okay, now when we say detox, okay, remember, even you want to test, you can test. You can test the sweat, you can test the urine. I come into urine. Urine, you got many funny this thing. One day I went to Sabah, no? Then they asked the same question, do you put any color in the granuloma? No, I said don't put it on. Okay, then one fellow told me that after granuloma, he has a rainbow urine. First, the urine is red in color. Okay, then come out with a green color, a blue color. Now, also a color in the urine, you know. Hey, you see, he asked me, you know, why is it like that, you know. Okay, I said, I don't put any color, no. I said, my color. Actually, he's suffering from this arthritis, no. The knee pains. So he go and buy all the painkiller in the market, you know. The painkiller come up with all sorts of color, you know. Okay, red color, blue color, green color, all the color, you know, this thing. After taking Ganotherapy, all this color come out one by one. I think Ganotherapy also very clever, you know. You can sort out the color, you know. Just the rainbow color, it's very funny, you know. And many people after taking that, the urine turn smelly. That is very, very distinct. That's why we have also many allopathic doctors, you know, who join DXN. They need, they told me they do this urine analysis before the taking Ganotherapy. After the taking Ganotherapy, they can see all the toxin in the urine. You know. So this thing can be tested and can be tested. Okay. So this on the urine. Okay, on the urine. Then the stool. The stool. Okay. So we have one case in Singapore. After taking Ganotherapy, suddenly suffering from constipation. Constipation. Okay, so about more than 1 week now, constipation. So when the stool finally come out, the stool is bright yellow in color, not yellow. The stool should not be yellow in color. The stool should be brownish and bright yellow. The sort of is light. Then he told me why is it so. Then this thing, I asked him, what is the profession now? Actually, he's working in a textile factory. He's in charge of the dyeing, you know. Okay, and then all the sari, this sari called everything, this brownish yellow. Okay, so I think the color go into the body, come up with the stool. Come up with the stool. Okay, when come up with color, we have also another very funny. You see, in our style, there's one artist now. Okay, he's obsessed with blue color. Okay, in his painting, everything is blue. No? Okay, the flower is blue. Okay, the tree is blue. The beautiful women are blue. The moons are blue. Everything is blue in color. And he's very crazy. This thing. When he drawing, he even use the hand to the body. He's very crazy. This thing. Okay, after taking the Ganotherapy, the urine come out also blue color. Blue color, no. The shock of his life, no. I told him, no. This color all go into your body. Okay, it discharges out. So this is on the detox. We have a lot of this detox thing. Okay, so today maybe due to time consuming, I don't talk too much to you. So basically, from you see upper body, it go through vomiting. That's why when you take herbs, you take everything, it induces vomiting. Don't get worried, you know. Okay, one more example about this vomiting. I think one of our staff, okay, so we give Ganotherapy, giving herbs to the mother. Mother is 90 over years old. 90 over years old, okay, a very bad temper. Mother, after taking a telephone to my son, vomiting out, he said, I'm going to die, you know. Okay, because when he talks, your energy level coming down, you feel very tired. You are not feeling good. Detox will not make you feel good. Remember, okay, it will deplete your energy. Okay, then I told my staff, don't worry, you know. Okay, you warming up something blackish in color like coffee, you know. Okay, I say this due to the blood stasis. It means that there's something wrong. Also, this thing, you know, warming for a few days, you know. Then after that, the mother become peaceful. When your stomach is something wrong, the person become very emotional. So when the old people become very emotional, become very grumpy, you know, become keep on talking, nagging, give them a lot. This is the thing. Okay, so we also put Ganotherapy into coffee, and we give a lot of good testimony on a coffee. Okay, so we always advise the husband. Okay, when you go back home, your wife keep on nagging you. Don't quarrel with the wife. Give a cup of DXN coffee to her. Everything will be okay. Yeah, this is the thing. So this is on the detoxification. Coming to the balance back. Now, balance back, they are more tricky, you know. Okay, our body, we have this system. Now, in ancient time, you know, how they classify the organ system? They don't have good anatomy. They don't have this thing, you know. How do we know there's a lung system? heart system, stomach system. How do they? It's very simple. The upper body. The upper body is either heart or lung. Lung is very easy to observe. Because if anything wrong with the lung, it's very observable. Okay, either you have a difficulty of breathing, you're coughing, you're a lot of phlegm, everything. Okay, so if any upper body problem, if it's lung, I classify. If it's not lung, all classified into heart. So when you read the ancient text, when you say the heart system, sometimes nothing to do with the anatomy, Okay, for example, like the palpitation. Okay, why a person feel the heart boom, 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 boom? Actually, due to animal, due to the water retention in the body, so that when the heart beat, you vibrate the water. It's nothing to do with heart, the palpitation, but they all classify into heart problem. For example, a person having this serious depression, then they have a chest congestion, it's heart problem. It may not have anything to do with heart problem, but in ancient time, in the upper body, okay, it's either lung or it's heart. Lung, you can observe, If you observe, it's not lung at all classified into heart. And when it comes into the internal, middle and also lower body, now, if it's stomach problem, it's easy to observe. Either stomach pain, bloating, okay, or this, what we call, or loose motion, or constipation. Then stomach problem also will cause certain kind of emotional problem. And stomach problem also always cause headache. You know why? Your stomach don't have any nerve now. Okay, we have three lining, internal lining, the nerve only at the external lining. So when you feel stomach pain, something very wrong. That means the ulcer will go to the upper layer. So in the first layer, you don't feel any pains. Okay, but your body need to warn you. Something wrong with your stomach. This warning comes from the brain. Okay, then you feel headache, feel migraine. That's why many people, when they have migraine, the headache, you should suspect the stomach problem. Okay, this is the microtherapy. This is a thing. One day when I'm in India, this one doctor come to see me. Okay, he is having strong migraine, doctors. He also told me that after taking all the medication, the migraine is still very serious now. So he asked me, maybe you have anything to this thing. Then I check him. I say, do you have stomach problem? He say, yes. I say, his family, all have stomach problem. I say, why don't you treat the stomach? He said, I'm suffering from migraine, This is my main problem, I said, no. I said, your problem is the stomach, This stomach will cause the migraine. Okay, of course, come back to the normal, give me the mind, give me this thing, treating. Then after everything, when the stomach is balanced, the migraine disappears. So stomach problem you can observe. Now, if it's not stomach problem, anything to do with the blood, then they put it in the liver problem. Anything to do with the water, then the kidney problem. So when you read the ancient text, when they say the kidney system, nothing to do with the anatomic kidney, it's a water system. It's water system. So the kidney problem also, they also tell sign, also called the urination problem. Urination problem. Okay. Now this water discharge from the body for a few ways. Lower body, urine and stool. Okay. So when there too much urination will cause constipation. Okay, this water problem. But too much loose motion, okay, then the urine become less. Then you know, this is kidney problem. Okay, then you have a lot of soaps, everything to stop the kidney. Okay, then if this is not water problem, if this is not water problem and it's not the stomach problem, then all put into liver problem. And the menstruation pains of a woman. It's not water problem, the stomach problem, we put it to liver problem. Okay, go into the liver problem. So we treated a lot of menstruation period pains, So put under the liver system, but it had nothing to do with the liver. So when you study this microtherapy, remember, this is something observable, it do not link to the anatomy. When we say kidney system, doesn't mean that your kidney have problem. No. When we say liver, in the ancient time, they don't have this kind of anatomy. Okay, this is very micro way of classifying. Is it important? Of course important. I told you just now the Indonesian this a case now. I give you one more case now. One of my staff many years ago, she started suffering from this miscarriage, second time. He would have miscarriage. Then the doctor checked that he had a cyst in the womb. Need to operate, and operation very costly. It will cost about 40,000. 40,000 for staff is a huge amount of money. Not only that, doctor say after operation, the chances to get pregnant again is very, it may not be, it may compromise your this thing. So I just session here. Okay, thank you very much.
Ladies and gentlemen, it is with great pleasure that I introduce our esteemed speaker for today's discussion, Dato Lim Siow Jin, founder of DXN. Dato Lim graduated from the famed Indian Institution of Technology. Dato Lim has a deep interest in mushroom and their relationship with human health. After more than 20 years of careful research and scientific analysis, Dato Lim discovered specific benefits of Ganotherapy or Lingzhi and its corresponding effects on human health. Realizing Lingzhi's important and health benefits, Dato Lim began sharing his knowledge about these miraculous herbs among his friends and colleagues, who mirrored his passion for good health. Dato Lim did not stop there. He felt that he should form a company that would help more people get acquainted with the benefits of these miraculous herbs. In 1993, Dato Lim's dreams came true when he established DXN in Kedah, Malaysia. Let's give Dato Lim a warm welcome and a loud round of applause.
So, good morning. So, Professor Dr. Zabidi Hussain, as Vice Chancellor, University of Sarjaya, Professor Dr. Mudayarasan Kupusami, as a Deputy Vice Chancellor at University of Sarjaya, Associate Professor Dr. Ibrahim Osman Haska, Dean of Faculty of Traditional and Complementary Medicines, this Dato Colin Chai, Special Consultant to DXN Holding Bagat, Dr. Siwa Kumaran Karupia, Crown Ambassador of DXN Holding, then Dr. Khan Muhammad Yamin, Lecturer of Faculty of Traditional and Complementary Medicines, Dr. Resmi B. Dewan, Lecturer of Faculty of Traditional and Complementary Medicines, Professors and Lecturers, distinguished guests, my dear DXN member and friend. Once again, good morning. So before I talk about Ganotherapy, okay, allow me to spend a few minutes about this integrated medical approach. Okay, now we are combining the Western medicines and also the traditional medicines. Basically, this medicines like engineering, they are various faculty, okay, and each discipline have their own way of training. Okay, so for me,